In today's class, we're looking at blood sugar level. Now, looking at the blood sugar level, we want to look at what we consider as the normal blood sugar level range. Now, if you have a blood sugar level of about 60 milligram, I like this pen, 60 milligram per 100 cm³ of blood. Well, if you take this range, 60 to 99 milligram per 100 cm³ of blood, that is during fasting, then we can say that this guy has a good or a normal blood sugar level. And it is good, if you want to test your blood sugar level, to do that 8 hours or 12 hours after eating. That means you won't take anything for 8 hours or 12 hours to ascertain the normal baseline for it. So this is normal. All right. Now, if there is abnormality, maybe there is an increase or a decrease in the blood sugar level. If there's an increase, it is called hyperglycemia. Now, when you have a blood sugar level of about 100 to 125 milligram per 100 cm³ of blood during fasting, this is considered to be called hyperglycemia. Hyperglycemia, and also it could be called pre-diabetic condition. Okay, now because at this level the blood sugar level is increased, and then it's about, or it's close to becoming diabetics now, or to forming diabetics. Now, if you have, this is a high blood sugar, hyperglycemia. All right. If you have a blood sugar that's about greater than equals to 126 under fasting, all right, so this is now called a diabetic patient, someone that is suffering from diabetes mellitus. Which is the DM. And you know that diabetes mellitus is different from diabetes insipidus. If I'm talking about diabetic insipidus in a moment, now in this condition, it's a condition in which the anterior part of the pituitary gland is not able to secrete the hormone ADH, which is known as the antidiuretics hormone or vasopressin. Now, when there is not enough secretion, or when there is failure of the ADH antidiuretics hormone or the vasopressin that controls and regulates urine formation, there will be loss of water, or the person will have a condition of frequent urinating, and that is known as diabetes insipidus. But we're talking about diabetes mellitus. This is DI. Now we're talking about diabetes mellitus, which is a condition where there is high blood sugar level in the blood. Now, if at about greater than equals to 200, Okay, this is, let me put it there, milligram per deciliter. Some will say per deciliter because 1 deciliter is equivalent to 100 cm3. Now, at this point, this is a diabetic patient. Now, if you have 180 to or greater than equals to 200 dl deciliter or 100 cm3. Now, this is random. This one is when you are fasting. Now, this is random. All right. In any case, the person is suffering from diabetes mellitus. All right. Having said that, what do we mean by hypoglycemia? Let me use another pen for that. Now, this condition, maybe someone is suffering from diabetics and then he's taking some injection and medications so as to reduce the blood sugar level. And then if he overdose or overtake the injections and the medication, he could lower the blood sugar level to a point that it will be less than 70. And if the blood sugar level is less than 70 milligram per 100 cm3, this is considered as hypoglycemia. During fasting, this is considered as hypoglycemia. All right, so this is the range. A normal blood sugar level at fasting, just being not eating food for 8 to 12 hours, should be 70 to 99 milligram per 100 cm3 of blood or deciliter dl of blood. So this all you need to know about the blood sugar level. Now we want to go to the blood sugar level and then the carbohydrate metabolism in the blood, because it is the liver that controls the blood sugar level. So let's check out the carbohydrate metabolism in the blood. I think we can clean up this. The carbohydrate metabolism. Now, there are 3 processes that is involved in carbohydrate metabolism. Number 1 is glycogenesis. Number 2 is glycogenolysis. Number 3 is gluconeogenesis. So this is the 3 conditions that regulates the carbohydrate metabolism in the body. We'll talk about the first one, which is glycogenesis. What is happening here is that the pancreas secretes an hormone known as insulin. That is glucogenesis. And the insulin converts the excess sugar, free sugar in the body, to glycogen. Let's do the math. Now we have free sugar. We're talking about glycogenesis. So talking about glycogenesis, we have free sugar. And then this free sugar is acted upon by insulin. Use a blue pen now. Now, insulin converts the free sugar into glucose phosphate by the process known as phosphorylation. So we have the process of phosphorylation. All right. Now, the process of phosphorylation, free sugar is converted to glucose phosphate. Now, the glucose phosphate undergo condensation. and then to form glycogen. Now, this process is called glycogenesis. It's just a process by which free sugar molecules in the blood, in the body of organism, is converted into glycogen. How is it done? The pancreas or the pancreas releases an hormone known as insulin, and insulin acts on the free sugar, and then by process of phosphorylation convert it to glucose phosphate and then to glycogen by condensation. All right, now this is glucogenesis, and this is a process of storing free sugar as glycogen. Now, what if you have not eaten for some time? Now, if you have not eaten for some time, there will be a need to reverse this glycogen back to glucose. So we're going to be having the process known as glycogenolysis. Now, what's happening in glycogenolysis? We're going to convert glycogen. Of course, you should know that the pancreas is an endoexocrine gland, secretes insulin and glucagon, and also some enzymes like the amylase, the lipase, and the proteases. All right, so this is glycogen acted upon by glucagon now. So glucagon converts this glycogen to by a process of phosphorylation to glucose phosphate. And then from glucose phosphate, you now have free sugar. All right, now, when the level of glucose or the glucose in the blood has been exhausted, when you have used up the whole glucose in your body, and the body needs glucose as a source of energy, as a source of fuel to carry out its activities, and you have been fasting for 3 days, 4 days, 5, you have not eaten for a long time, what will happen is that glycogenesis, which has stored glucose in your body, glucogenolysis will now release the already stored glucose in form of glycogen back to free glucose. When the glucose has been exhausted, then gluconeogenesis will now set in. So what we have here, we have this guy, gluconeogenesis. Now we're going to take it from here. Gluconeogenesis, just pay attention to what I'm saying. And the gluconeogenesis, at that point, the anterior part, okay, because this ADH, antidiuretic hormone, and vasopressin is produced by the posterior part of the pituitary gland. Now, the anterior part of the pituitary gland produces an hormone known as ACTH hormone. So we have ACTH, and ACTH is known as adrenocorticotrophic hormone. The adrenocorticotrophic hormone is being sent to the adrenal gland. The adrenal gland is made up of two, inner and outer part. The outer part of the adrenal gland is known as adrenal cortex. Now, this is sent to adrenal cortex, remember, is coming from the pituitary gland. I need to make this clear for you. Let's start the process again. Gluconeogenesis. All right, pituitary gland first. Not just a pituitary gland, anterior pituitary gland. Anterior pituitary gland produce ACTH, which is known as the adrenocorticotrophic hormone. Now, this adrenocorticotrophic hormone is sent to the adrenal gland, the outer cortex of the adrenal gland, the adrenal cortex. The adrenal cortex, which is the outer region of the adrenal gland, now by the inducement or by the activity of the ACTH, ACTH, adrenocorticotrophic hormone, now produces the corticosteroids. Which is also known as cortisol. So what happens is that the cortisol will now begin to look for fuel, source of energy from the fatty tissues or adipose tissues. Now, by the process of looking for fuel from non-glucose source, and then it will get to the fatty tissues or fat. From these fats or fatty tissues or fatty layers, then from the fat will now be used as a source of fuel. So this is now used as a source of energy. So this is the process of the regulation of the blood sugar in the body. First of all, we have glycogenesis, glycogenolysis, and gluconeogenesis. So that's what is happening. So you make sure that the blood sugar level in your body is normal. And then it's not good to have a low blood sugar level. The individual might even slump while carrying out the normal daily activities. So this is all we've got for you in this video. If you have a question, drop it in the comment section. We'll be right back to help you. Thank you very much for watching. Have a successful day.